Welcome. In this video, we'll look at some common psychological concerns for people who have serious and life-limiting illnesses. McCaffrey and colleagues reviewed 24 studies from around the world to learn what was important to quality of life for palliative care patients. Emotional factors, which contribute to psychological concerns, were important to patients in 20 of the 24 studies. Psychological and emotional concerns include sadness, anxiety, despair, frustration, fear, guilt, and uncertainty. For example, one patient said, "I panic and get frightened when I'm alone and when I don't know what symptoms I will have or how long I'll live. I'm frustrated because I don't know what will happen to me." People vary in their ability to cope with high levels of uncertainty and with big changes in their lives. Another patient said, "It sometimes feels hard to keep your spirit up or get on with things when you're as old as I am anyway, but it's better to try and find some quality in life instead of going around feeling upset and sad and not wanting to do things." People can feel both internal and external pressure to have a positive attitude and fight the illness. Unfortunately, this pressure to be positive can lead to shame or guilt about feeling normal, negative emotions. All emotions are normal with serious and life-limiting illnesses. It's natural to worry about your future and your family's future. It's normal to feel relief about not being able to work anymore. It's normal to feel sad about many losses that come with long-term illnesses. Most palliative care patients experience emotional and psychological distress at some point in their illness journey. People are more likely to have psychological distress if they have mental health conditions, abuse drugs or alcohol, lack a good support system, have challenging family relationships, or have spiritual concerns. Psychological concerns also include depression, demoralization, complicated grief, and a desire to hasten death. Next, we'll consider some common social concerns. 24 studies were reviewed from around the world to learn what's important to quality of life for palliative care patients. Every study included social concerns. Social concerns focus on relationships with family, friends, co-workers, healthcare providers, religious leaders, and other people and groups in the person's community. Patients and families may worry about having the emotional and practical support they will need in the coming days. Patients are often concerned about being a burden on their family. As you'll learn in upcoming sessions, the feeling of being a burden is an important cause of suffering. Money is also a social concern. Finances affect relationships with family, employers, landlords, and insurance companies, to name just a few. Patients and families may also be concerned about their relationship to the healthcare system. This includes being able to get the healthcare they need and the ability to remain at home as the illness progresses, if that's their desire. Another area of social concern is preparing for death. Saying goodbye, making funeral plans, leaving a legacy, and handing over tasks to family members can all be stressful. In the next video, we'll consider some common spiritual concerns.